He's been called the future of the Republican Party. Unfortunately, Ryan Seacrest couldn't be with us tonight, but we do have the next best thing in the form of Michigan Congressman McCotter to talk about this and that and that and this. He writes bills like I take pills. So, Congressman, how you living?
Above ground. How about you, Greg?
Just barely. I'm crawling. Hey, let's talk about Obama's upcoming address on Wednesday. What do you think he needs to say versus what he will say?
Well, I think that for quite some time the president's had a position with general goals, but not much of a roadmap in terms of concrete, specific policies to get there on health care. This has caused a problem within the Democratic Party, whereby you're seeing a war between their progressive wing, which wants the public option, and their centrist blue dog wing, which does not, and the American public, who do not want it as well. So they have to make that determination. I think the number one thing we want to see from the president is where he comes down on the inclusion of the public option within the bills in front of Congress, whether he will insist upon it or whether he will back off of that.
I got to ask you, I think this is the most important question of this interview, is what is behind you?
That's a nice try, Greg. I'm not turning my back on you.
I just have a feeling there's something furry behind you, but I won't bring it up again if it's a sensitive issue. Anyway, I got to ask you,
it's a rather lurid statement on your part.
I know. You know what drives me a little nuts with President Obama is the bringing up of anecdotes about families with health issues. I think what he's trying to do is always personalize this issue, but he doesn't realize that unless it's somebody's own personal problem, they don't care. Like when he brings, and I hate it when politicians do that. Do you think he's going to do that again? How many times is he going to do it?
Well, I just want to assure you, first and foremost, Greg, I would never exploit your own personal miserable existence for any political reason. Let's be cool. I mean, we're friends. Kind of. But what we want to do is keep the focus. We understand that there are 15% of the country that does not have insurance.
Yeah.
But the fundamental debate we're having is, in attempting to help them, we do not want to radically change the system for 100% of Americans, because most people are happy with what they have with specific concerns. And I think that this is one of the bridges that we have to cross together to help those 15% without impairing what 85% want to keep.
I was going to correct your math because it was 115 before, but now you got it right. It's up to 85 plus 15 is 100. Well done, Congressman. What is the solution for health care? If this is another issue, by the way, that Obama doesn't have a worthy Republican adversary who he can talk to and say, okay, what do we need to do to make this right? If you were in the room with him, what would you say that this bill needs, or what would you do?
Well, thank you for belittling every member of the Republican Party as not being a worthy.
No, but you know what I mean. It's like he's got both houses. That. He's got a sense of a mandate, and he could steamroll. Well, the problem, that's one of the problems, Greg, and I will answer your question about Republican alternatives specifically. But first, the Democratic Party right now does have the ability to pass something in the House without any Republicans and without a whole lot of Democrats. Right.
They can pass it in the Senate. They control the Senate. They don't merely have a majority, they control it.
Right.
So the question they have to make is, how are they going to get enough of their members to pass it if they go it alone? And I don't think that's what they want to do. That would not be well for the country or honestly well for their members. The Republican alternative is premised not on reducing the supply of health care to try to curb costs, because we know that won't work. If you reduce the supply at the time demand is going up because of demographics, the cost goes up. What Republicans want to do is unleash competition to allow for more supply to come into the system, to allow patients to be empowered as consumers. Ones right off the bat are increasing health savings account, tort reform, make sure people can buy insurance across state lines so they force these insurers to compete, allow small businesses to pool together for association health plans so they can leverage trying to get the best deal for health care coverage for their lower income employees. And for the uninsured, one of the things you have to make sure of is that you have to have access at points like federally qualified health clinics, which are community based, and would allow them a sense not only of having a sense of community, but preventative maintenance and become owners of their own health care concerns. These are all things that Republicans can support, and we're just waiting to see whether they wish to work with us or not. It is their prerogative. They are the majority, and they don't have to if they don't want to.
You know, that makes a lot of sense, Congressman, but I need to know more important things. You know, we've got the NFL approaching. Chances of on a scale of 1 to arena football. How will the Detroit Lions be this year?
we in Detroit are tired of being dragged through the national spotlight in a derogatory light. I assure you that my Lions are going to surprise people.
Yeah.
My Detroit Tigers are 5 games ahead in the American League Central. The Pistons are rebuilding, but the Red Wings were 1 game, 1 goal away from the Stanley Cup. So as far as I'm concerned, you can laugh at the Lions all you want, but when we win that Super Bowl, it is going to be sweet.
All right.
None of us will be alive.
All right, Congressman, we got to roll. Thank you so much, and we'll see you real soon. Have a good